Hi, there are 5 R's of medical aesthetics to treat anti-aging. The first one is to relax. We want to relax the underlying muscle that creates the wrinkle, such as the muscles that create the frown, the forehead muscles creating the horizontal wrinkles, and the muscles around the eye causing the crow's feet. So we use a neuromodulator such as Botox to relax. Secondly, we want to revolumize. As we age, we lose volume. That then causes nasolabial folds, marionette lines, and jowling. So one thing that we can do is to restore the lost volume in the mid-face. That's where we want to start first by creating a lifting effect. We can also put filler in the nasolabial fold, the marionette lines, or the jowls. Reduce. So whether it's due to genetics or weight gain, sometimes we get fullness underneath the chin, and we can reduce that with cool sculpting, Kybella, or even Ultherapy creates tightening underneath the chin. Resurfacing. As we age, we're exposed to the environment, ultraviolet rays that causes hyperpigmentation or brown spots, photo damage such as wrinkling. So resurfacing the skin, such as with the halo laser. And repositioning. With age, we get laxity of the skin, laxity of the underlying muscles. So a surgical facelift is one way to treat that, but if you're not a good surgical candidate, or maybe you're just not ready to take that step, lifting with PDO threads may be right for you. Hi, I'm Lauren Olson, physician assistant, founder and owner of Radiance Medical Aesthetics and Wellness. And I'm so excited to tell you about PDO threads today because it's one of my most favorite procedures to perform. The results are immediate. So PDO stands for polydiaxanone. It's the very same thing that absorbable sutures are made out of. They gradually dissolve over about 6 to 8 months. Now, the first PDO threads that came out about 20 years ago were non-dissolvable, made out of proline. The problem was that some people could develop a foreign body reaction to it, or if they broke, then they'd have to go in and dig them out, so it was problematic. They kind of fell by the wayside. And then about 9 or 10 years ago, the PDO threads, or the threads emerged now as the PDO or polydiaxanone dissolvable threads. And what's wonderful about them is that they gradually dissolve over about 6 to 9 months, but while they're in, the body builds collagen around them. Just like when sutures are used for surgery, the body heals around those sutures. And so what you're left with now is your own collagen creating that lifting effect that can last for several years. Now, when I first assess a patient, and many times they're talking about they feel like their face is melted, that it's dropped. And we discuss various treatment options. Now, Starla is young and beautiful, but we're going to use her as our model today. And so what we want to do is reposition with these sutures, the PDO threads, in an upward position. But when I do the assessment, I want patients to have a very realistic expectation of what the threads can and cannot do. So one way to do this, and you can do this at home, is to lie down on your bed at home, get a mirror. We're gonna let gravity do its nice thing. And so if I lie Starla back, she can see that the laxity and the weight of her face now falls into a natural position. And if the patient is happy with this appearance, these results, then I say that this is a realistic expectation of what we can achieve with the lifting PDO threads. Now, there are 2 different types of PDO threads. One is the lifting or barbed, the other is smooth. The smooth threads are as thin as a strand of hair, and they're used to treat acne scarring, fine lines and wrinkles, crepey skin. We like to place it under the jawline to tighten the skin here. But the lifting threads are placed along certain vectors, and typically we'll place from the nasolabial fold up, corner of the mouth up, jawline up, from here up. We can also do a brow lift with the threads, jawline lift, giving that nice snatched jaw, and the neck also. We can also treat anywhere on the body. Well, let me back up and say that first what we do when a patient comes in on the day of treatment is to cleanse their face and use a topical disinfectant. We pull their hair back and I'll draw vectors that we're going to use to treat on that day. I'll numb the insertion point, and I'll also numb down each individual track. Once the patient is numb, then the cannula is placed into a little needle hole opening. It's not even an incision, it's just a needle point opening. And the cannula is placed down the track. It goes underneath the skin and above the muscle. The cannula is removed and the thread remains in there. And we can do face, jawline, neck in about an hour or less. The first week, the patient will be a little tender and may have little, what I call zingers. They'll limit their facial expression just because of, they may have some discomfort, but it's nothing that Tylenol or Motrin can't take care of. So if you enjoyed this, I would encourage you to go to subscribe to our channel. We are on all social media platforms, and give us a call for a complimentary consultation.